After the examination of the hand, one should also check the head, starting from the scalp, looking for the texture of the hair and for any hair loss here which suggests alopecia, and also look at the temporal recession. Presence of temporal recession in female may suggest virilization. After that, check both eyes, especially for the eye, brow, eyelashes, eyelid, and the black part of the eye, which is the cornea, and the white part, which is the sclera. Really, if we have loss of lateral 1/3 of the eye, brow, this may suggest hypothyroidism and may occur really in leprosy and so on. We have to, in the eyes, we have to check for the presence of jaundice and for the presence of anemia. Anemia is identified clinically by the presence of conjunctival pallor, and if the sclera is yellow in color, one should consider jaundice. Really, the examination, when you examine for anemia and jaundice, simultaneously examine for them and ask the patient to direct his face into the natural light, which is usually obtained through the window. If we suppose that the time now is daytime and the curtain is pulled apart and natural light is obtained, I'll ask the patient to turn his face toward that side. بس حمال يكتبها هنا الشباك. Okay, after he had turned his head, I'll check for the presence of jaundice in the following manner. I'll ask the patient to follow my finger. هسه بس باوع اصبعي ورا اصبعي. Okay, if we see here both sclera are visible, we can detect whether there is yellowish discoloration or not. After that, I'll ask the patient to follow my hand up, and I'll press to see the conjunctiva. على ايدي. Okay, the other one. Also, after that, I'll check both cornea for arcus lepidus and also for KF rings, and for the pupil size, whether they are narrowed or constricted, or they are dilated, or they are irregular in shape. This really with respect to the examination of the eye. After that, I'll check the external ear, really check for any abnormality, tenderness here at the tragus, and check for any discharge. Also, in the same manner, I'll check the other eye or the other ear for any abnormality. I'll press for tenderness in case of infection, and I'll see the external auditory meatus. After that, I'll take a look at the nose, seeing in particular the septum, ele nasi, and look for any discharge or nasal polyp. Really, here loss of some part of the symptom, depression here, indicates saddle nose that may occur in relapsing polychondritis viginus and in leprosy, and also in many other clinical conditions. After that, I'll check the mouth. First of all, I'll inspect the mouth for any deviation in the resting state. After that, I'll ask the patient to open his mouth. افتح حلقك حماده عشتي here, because sometimes the opening is so restricted in case of microstomia and typified the clinical of scleroderma. After that, I'll see the tongue inside the mouth in the resting state. بس افتح حلقك حماده for any fasciculation. Okay, after that, I'll check the lips, both inner border and outer border, the cornea, the corners of the mouth, and also the upper lips for any ulceration or infection. After that, really, I'll use a torch for the internal aspect of the mouth. for the presence of any dental caries, for high arched palate in case of Marfan, and for the presence of infection. After that, I'll ask the patient to raise his tongue, ارفع لنا لسانك, to see the sublingual tissue. This is the sublingual tissue. على راحتك. Really, after that you complete the examination. After you complete the examination of the mouth, you have to put in your mind that the sublingual tissue may be discolored, yellow in case of jaundice, may be pale in case of anemia, and it may be involved in case of cyanosis. Cyanosis here, if it involves the tongue plus the sublingual mucosa with the involvement of the lips, this is most likely central, especially if it is accompanied by digital clubbing or warm hands. If the hands are cold, the extremities as a whole are cold, and there is no involvement of the tongue, one should expect that the patient had peripheral cyanosis. Really, if the patient had combination of both, that's to say, the patient had clubbing, for example, but the extremities are cold with no involvement of the tongue, one should comment on this, that there is a central and peripheral cyanosis. In reality, the candidate should also know about other types of cyanosis, which may the examination committee ask him about, including the differential cyanosis and acrocyanosis.